Skipping on sleep has become the daily routine for most of us. With everyday stress, whether it is work or personal crisis, something always keeps us up. With the copious amount of stress that we deal with, taking a sound sleep is not only necessary for our bodies, but rather a savior. Poor sleeping habits and lack of rest can also affect blood sugar level and insulin sensitivity. Sleep deprivation decreases the release of growth hormone and increases the cortisol level. Both of these play a role in pumping up the blood sugar levels. Cortisol opposes the action of insulin and increases insulin resistance. Furthermore, adequate sleep is about both quality and quantity. It is best to get a sufficient amount of high quality sleep every night. For adults, we would advise at least 7 to 8 hours of sound sleep. However, lack of enough sleep is quite common in diabetic patients to the courtesy of their kidneys. Anytime your blood sugar levels are high, your kidney try to get rid of the excess sugar by urinating. This can disrupt your sleep cycle to a major extent, apart from the added stress and depression of the disease. When you get a good amount of uninterrupted sleep, your body resets for the next day while also reducing your blood sugar levels. If you are confused and want to determine whether or not you are sleep deprived, the answer is most likely yes, because the amount of stress that every individual is subjected to in this super speed world is ginormous. Here are some tips we provide to our diabetic patients. Increase bright light exposure during the daytime. Increasing the bright light exposure during the daytime will help better your circadian rhythm, which helps in keeping your sleeping pattern. With a sufficient amount of exposure, you can increase your daytime energy and better your sleep quality by leaps and bounds. Second, go easy on the blue light exposure during nighttime. Exposure to blue light suppresses the secretion of melatonin, a sleep hormone that influences circadian rhythm. Dialing down the screen time at night improves sleep, whether it is your laptop or phone, can be of great help. Using apps to cancel out the blue wavelength emitting out of your device can be a good idea as well. However, it is best to avoid screen exposure 2 to 3 hours before sleep hours at all. Third, avoid daytime naps and irregular sleep. While short power naps are believed to increase your brain activity and productivity during the day, prolonged naps can cause more harm than good. Sleeping during the day can confuse your biological clock and even make you sleepier in the daytime and keeps you wide awake during the night. Fourth, avoid alcohol at night. Alcohol may seem to be helping you to sleep as it helps induce sleep, but overall it is more disruptive to sleep, particularly in the second half of the night. Alcohol consumption can negatively affect your sleeping pattern while also make you vulnerable to anxiety, depression, sleep apnea, snoring, and a list of other problems. Fifth, avoid exercise before bedtime. While exercise can increase adrenaline and epinephrine levels, which increase energy levels during the daytime, but can disrupt sleep and excite your body to make it harder to fall asleep. Last, enriching your environment. Listening to soothing music before going to bed, using scented candles, and dimming the light 1 to 2 hours before going to bed can also help you doze off. You can use the sleep feature in our app to listen to this soothing music and get a stress-free sleep. Lastly, do not forget investing in a good bed, mattress, and comfortable pillows. Also friends, if you find this video helpful, then please like and share. Don't forget to subscribe the channel so you will never miss any diabetes related update. Thank you.